Hello, we're going to talk about how to give a subcutaneous injection today. Perhaps you have a friend or somebody who has a lot of allergies and maybe they carry an EpiPen, or you have a family member or a friend who has to take regular shots daily or just maybe monthly, and they happen to be subcutaneous injections. Maybe I can go over a couple things today that can help you out and you can help them out. I will be going over the steps that it takes to give your subcutaneous injection today, as well as the equipment that you need and also the areas that you can give a subcutaneous injection in. So to begin, what is subcutaneous skin and where can we find it? Subcutaneous areas are areas that tend to have a little more fat tissue under the skin. Adipose tissue is another word for it. Subcutaneous means it is underneath the dermal layer and into the fat. So usually your target areas to give a subcutaneous injection would be the back of your arms, where you can pinch up some skin and you feel the adipose tissue underneath, or also in the abdomen, anywhere 1 inch away from the belly button and all the way around, you can use as well. And another area would be the tops of the thighs, where you can pinch up, and usually you can feel the tissue underneath the skin and feel that there is some adipose tissue there. If you have someone who is thinner or skinnier and you're having a little trouble finding some fat tissue that you can give the shot in, you can always use the buttocks as well. So let's get started on what you need in order to give your shot. You're going to need disposable gloves, and you're going to need alcohol. You can use alcohol swab, prep pads, or you can use regular rubbing alcohol and maybe a cotton swab to clean the area. You're going to need a syringe with a needle. Usually sub-Q needles are a 25 gauge and no longer than 5/8 of an inch. They do make smaller ones that can be a 27 gauge and even shorter, but commonly we just don't want to go above 5/8 of an inch. I have a practice solution that we'll be using to pull up for our shot, but you don't always give a shot that you're going to have to draw up your solution. Some things come in pre-filled syringes, and things like EpiPens come already ready to give your shot. I am using a practice pad today to demonstrate the skin and how we can pinch it up in order to give your shot correctly. So let's get started. Go ahead and put on your gloves. The gloves are to help protect whomever you're giving the shot to from the germs on your skin, as it's not their normal germs. And also, if there would be blood and you come in contact with blood, then you're covered and it protects you as well. So let's begin with the alcohol. So you're going to take your alcohol and you're going to find a target area on your skin where you're going to want to give your shot, whether it be your arms, the abdomen, or the thigh. So just make sure that you can pinch perhaps an inch, pinch an inch, and make sure you can kind of feel a little bubble there where you pinch up, and then you're going to clean. So you clean in a circular motion, and you're going to start in a small circle and work your way out to a bigger circle so that you are cleaning a wider area and you take the germs with it. Allow that to dry. By allowing the skin to dry, the shot may not sting as much. So you take your syringe, uncap your needle, and a general rule of thumb if you're going to draw up your own solution is you pull back as much as you're going to give. So say we're going to give 0.5 mLs today, we will pull that much air up. So I'm also going to take my alcohol swab and I'm going to clean the top of my vial. Again, if you're using a pre-filled syringe, not necessary, but sometimes you have to pull them up. So you pierce the rubber stopper and invert the vial. You inject your air into the bottle and you pull back your solution to your desired amount. So in this case we're doing 0.5. Then you pull out. So now that you've cleaned your area of skin and you're ready to go, your skin is dry, you pinch up once again where you're going to give your shot, and you put your needle at a 90-degree angle. If there's not a lot of fat tissue to work with, you might would put your needle at a 45-degree angle to keep from injecting the muscle. So we're going to go with a 90-degree angle, and you inject quickly, not slowly. The slower you inject, the more it will hurt. And then you inject your medicine, pull your needle out, and release the skin. If by chance you have a patient who may be bleeding or something, you can wipe it with some gauze or put a Band-Aid over top of it. Now with your needle, there's usually a safety device that you can slide up over the needle to help prevent from poking yourself with the needle. If that's not the case, then just get rid of your needle in a sharps container without touching anything else. Make sure that's a priority so that you are not getting stuck with the needle. And that is it. You are done. It's not so hard. I have went over the tools that you would need as well as the knowledge that you would need, and I hope that it does come in handy if you would have to give a subcutaneous injection in the future. Thanks, guys.